Dr. Patt with Little Critters Veterinary Hospital. I've been a practicing veterinarian on exotics and small animals for about 25 years now. Consider liking, sharing, subscribing, and definitely leave the comments. I love hearing from you. Thank you. And we have a litter of baby bunnies with us today. They're 7 weeks old, and they're kind of all over the place here. They're very social bunnies, and so they're exploring and checking everything out, which is wonderful. They're doing a great job raising them. The reason we're showing these bunnies today is they have an interesting story. So their mom had been living loose in their neighborhood for 3 years, and this owner who brought these babies in has been trying to catch mom for 3 years. She's a domestic rabbit that was let loose. And over the years, she's had other litters in the neighborhood, so they have a population of rabbits there now. This owner was finally able to catch Mama, and she noticed that she had elongated mammary glands or teats when she found her, and she's very rabbit savvy, and so she started knocking on doors and asking the neighbors if there was a litter of bunnies anywhere. And sure enough, one of the neighbors said Mama had been breeding or raising babies in her backyard for several litters, and so she set a protected area up in there. The rabbit would go in and out of the yard. She was able to rescue all of the babies, and she's keeping one of them and has found homes, I think, for the majority of them. When she caught Mama, she was already pregnant, and she has some neonatal babies at home already. She is a wonderful soul who's doing a great thing by this mama rabbit and all these babies and getting them off the street in Arizona. It's 105 today, not rabbit safe to be outside. It's amazing that Mama survived. And the risk for predators is huge with owls and hawks and coyotes and cats, which apparently were able to get many litters in the past. So she's doing a great thing, but the important thing here is obviously rabbits are a lifelong pet. They are not a temporary pet or a child's pet. They're no different than dogs and cats in the responsibility and the bond, and we need to be aware of that before we get one. And then when you do get them, they have responsibilities that go along with them, like spaying and neutering them. Female rabbits are very predisposed to uterus cancer. About 60% of them will get it. It's a very aggressive cancer that goes to the lungs, so they need to be spayed early. And they also need to be vaccinated for rabbit hemorrhagic vaccine. That is something that's a problem in the wild rabbits. It is highly infectious to domestic rabbits, and it is fatal. And so these babies are all going to be vaccinated today, and starting out right in life, we're going to get them spayed and neutered and make sure that they have good futures and long lives. And they came in as described as lots, but we're definitely not. As you can see, we're lion head crosses at least. So we've got all the fuzz going on in the little lion head here. And we have Pongo here today. And Pongo is here because he's having some eye discharge and some nasal discharge that the owners noticed. And if you look at this right eye, he has all this dried discharge around the eye. His eyelids are a little red and inflamed. That's called blepharitis. And the conjunctiva, or the tissue under the eyelid, is very red and inflamed as well. And now we're going to compare that to the other eye. And you can see there's no active discharge here. The eyes are more pink and less red, and the conjunctiva itself is more pink. There's a little bit of red just because he's stressed or excited because he's here, but significantly different than the other eye. And he does have a little bit of nasal discharge as well. These are common problems that we see all the time in rabbits. The tearing we call epiphora. It just means tearing, and it can be from an ocular infection. It can be from tear ducts that drain from the eye down to the nose that can be blocked. They can be plugged with mucus or pus. They can be scarred from chronic infection. They can also be blocked because the tooth roots up here will actually overgrow and block the tear duct so it can't drain and the tears spill over. And all of these are common problems leading to epiphora or eye discharge. There's also systemic infections. Typically we think of rabbit snuffles or pasturella, but any bacterial infection can present like this as well. And so we would recommend skull x-rays to see if these tooth roots are actually blocking the tear duct, culture and flush of the actual tear duct, and I'm not sure if it'll show up, but if you look down in the eye, the tear duct is a little slit down on the bottom of the eye. We put a catheter in there and flush it, and we should be able to flush through that and out the nose to flush out any debris. Some of these rabbits have such severe infection that nothing will flow through. They're just solidly blocked. And then we typically will do labs and just check systemically to see what's going on. The other thing he has is a little area of alopecia with some scabbing and some crusty skin. So if you look, you can't really see it at a glance, but we notice this is just a little thinner here. And if we look at his skin, you can see alopecia where there's no fur growing here. It looks like there was some fur loss earlier that's now starting to regrow, and you can see scabs here, and off to the side we have scabs, and you can actually feel some going further down. Rabbits with mites will present like this sometimes because they're itchy. We can also see trauma that can do this, although this doesn't look like bites to me from other rabbits. He does live with others. And fungal infections will often show up like this on a rabbit. We do need to check the skin. I would do a DTM, which is dermatophyte test media, where you swab and check for fungal, and then we'll often symptomatically treat for mites as well, particularly if they're clinical, if they're itchy, they're multifocal. We can also do a skin scrape and look under the microscope to see if there's mites present. For the respiratory infection, the treatment really depends upon the diagnosis, so it is important to try to get a diagnosis. We're talking about bacterial infections. When we culture or flush and culture this tear duct, we would choose an antibiotic spectrum based on what was grown from that culture, so we know how to treat it appropriately. Flushing it is often part of the treatment as well. And then if we're talking about tooth roots and overgrowth of tooth roots, the affected tooth has to be extracted. So that's the most significant if we have an issue with that. Rabbits' teeth, the crowns, and the tooth roots will continue to grow throughout their entire life. And we have a beautiful little baby bunny with us here today. This little bunny was just adopted, and it was born to a litter that was being raised outside, which we do not recommend in Arizona. It's way too hot in the summer in Arizona for outdoor rabbits, and they're exposed to a lot of predators and various diseases, so generally not a good idea. This little baby is now an indoor house bunny, and as you can see, we don't get much cuter than a baby bunny. You can see he has some urine staining on his feet, but that was the outdoor environment. He does have a little bit of snuffles. You can see some respiratory effort involved in breathing, and there's some dried discharge around the nose. And you can hear that when we listen to him. And so that's why his mom brought him in. And I say snuffles, but really any bacteria or even a fungi that causes rhinitis or nasal congestion is often referred to as snuffles. The common one we think of is Pasteurella. The point of this video is how we start our baby bunnies off right, and it's important when you get a baby bunny to understand that we need to do things for them just like we would for a new puppy or kitten. They're actually a little more complicated than a puppy and kittens. We need to ensure that we have them on the correct diet. I usually recommend the Oxbow Young Rabbit pellet for the babies, and then Timothy hay. Very early we'll put them on alfalfa, but I very quickly change them over to transition them to a grass hay. And as adults, we're only on grass hay and a grass hay based pellet, no alfalfa. But we do give the very young ones a little higher protein level. We do need to get babies vaccinated. So rabbits do get a virus called rabbit hemorrhagic virus. The vaccine is RHD2, and it's very important to get your bunny, even a house bunny, vaccinated for this. You can track this disease into your house. It is in the wild rabbit populations in most states now and in Canada. And the first vaccine is given at the initial exam if they're healthy, and then a booster is given 3 weeks after that, and then it's a once-a-year vaccine, and that is the only vaccine in the US for rabbits. It's an important thing to do. And part of our baby bunny exam is we determine what sex they are, because it's often unknown or sometimes the wrong sex, and we do name changes. But it can be a subtle finding in young baby rabbits. Females have a more slit-like opening, males have a rounder opening. Males can pull their testicles up into the abdomen at will, so you can't always and often don't see the testicles on these little guys. We do check the feces and run a fecal, because rabbits will get parasites. There's one particular parasite that can be pretty pathologic that we check for, and we treat that if we have it. And then we discuss all the basic rabbit care and training. So we go through the environment and what the environment should be for a house rabbit. There should be some area of a housing or caging so that if we're not supervised, we're in a safe, protected area. And most of my clients now will get the large gated enclosures from Amazon, and you can They're modular, so you can make different sizes and different shapes and give them a very large area in a protected room. And then when you're home, they can roam the house like a dog or cat, and most rabbits do that. It's important that we're not chewing on electrical cords and that those are protected. And baseboards are a common problem, so we need to observe the behavior, particularly in babies. Litter box training in baby bunnies is actually pretty easy to do. In general, they'll kind of pick an area to go in. I just put the litter box there, and then you kind of gradually move the litter box to where you want it to be. You can also put a hay manger above the litter box, and they'll often sit in there and pee and poop and eat their hay, and that's a common way of getting them trained. It is important to realize, though, until they're spayed and neutered, they often will fecal mark. So owners think they're just kind of randomly dropping pellets around, but it's a deliberate marking strategy. Once they're spayed and neutered, that tends to go away. So the litter box training may not be perfect. And then we need to do foraging behaviors and environmental enrichment for rabbits, just like we would for any other animal. I like getting like a large play pool. You can put a whole bunch of hay in there, and you can throw the pellets or the greens in, mix it in, and we have to forage and look through there. A lot of people will use tunnels and cardboard boxes. All of those are good as well. But the big thing is start out with a vet exam, make sure we're healthy. And if we have an issue like this little baby, then we want to make sure we get that issue treated. So we're not vaccinating this little one today. We're addressing the respiratory concerns, and then we'll get started on just preventative care. We have Momo here, who's a 5-year-old little lionhead rabbit. As you can see, lionheads have a lot of Angora in them, so we've got a lot of extra fur on the lionhead, but they're named for this little tuft. And this is part of our Did You Know series. So did you know rabbits have a very unique respiratory system? They can't physically breathe through their mouth. Their soft palate actually blocks their airway, so they're obligate nasal breathers. They can only breathe through their nose. So if rabbits get a respiratory infection or a stuffy nose, it's a much bigger deal to them, because they're forced to try to breathe through that stuffy nose, which if you think of yourself with a cold trying to breathe through that, it's not so good. So if you look at Momo, you can see on his nose, we've got a little bit of dried discharge there. We've got a little bit of discharge around the eyes. And so we're checking him out for that today. So we're running some labs, doing a basic health exam. So some causes, potentially bacterial infections, so like a sinusitis, Pasteurella or rabbit snuffles is a commonly thought of culprit, but it can be actually caused from many organisms. Dental disease can cause respiratory problems, so tooth roots can grow up and block the tear ducts, and they can certainly cause symptoms that look like respiratory. And then we often have problems with tear duct infections and blockage of tear ducts as well in rabbits. Did you know rabbits are obligate nasal breathers? Pretty special animals in many ways. We have Queso here, a French lop. They're one of the giant breeds. They can actually get even quite a bit bigger than this. You can see we have the big old long lop ears. Queso's here because he's leaking urine, so he has some urinary staining. If you look at his bum, we've got some urine staining down here because he's been dripping and leaking urine, and he's been peeing outside his box. One of the common causes for this in rabbits is urinary sludge. Rabbits make a lot of calcium oxalate crystals in their urine. That's very normal. And if they're a little bit less active, house rabbits often get sedentary, kind of like house cats. That crystal in the urine can settle out and form what we call sludge. It's almost like sand at the bottom of the bladder, which can be very irritating, can cause problems for them, can be uncomfortable. And one of the ways we prevent that is with a really good diet, which he is on. No alfalfa in the diet, should be grass hay base, pellet, and leafy greens, and no extra treats, no grains, no seeds, no fruits. And then activity is really important. So if you think of like a snow globe, when the globe is sitting still, that snow settles to the bottom. That's very similar to the sediment in the bladder. If they're not doing a lot, all that sand or sludge is settling out at the bottom of the bladder. And then when they urinate, they're not urinating it out. Whereas if they're hopping around and moving, they're shaking it up and peeing it out. So activity really important for house rabbits. Another problem that can cause urine leaking or kidney problems is echinoculi, which is an infectious disease of rabbits. And then certainly infectious disease is also an issue. We're going to get some x-rays on him today and just see what's going on inside. We have two absolutely beautiful bunnies, and they are a mix between Rex rabbits, which have this really dense, velvety, hypnotic fur, and lop rabbits, which have the floppy ears. And they obviously are a bonded pair and very much in love. They need their spay and neuter So we're getting that scheduled and we're drawing blood for that. And we have Jasper here, an approximately 4-year-old rabbit who was newly adopted through a rabbit rescue. And he came in for a health check. And we noticed some abnormal findings on his physical exam, and we're going to try to show you this. So he has very severely overgrown incisor teeth. And if you look at his lower incisors are growing up into his lip on the top, and the upper incisors are growing back and into his mouth. We're doing a dental on him today to trim these teeth. This brings up a very important point with rabbits. Their teeth grow continuously. Both their crowns and their tooth roots grow all their life. And dental disease, particularly with a poor diet, is very, very common in rabbits. And it's very important to be aware of the rabbits. You want to watch them, see how they're eating, make sure they're not drooling or dropping food. Watch their weight and body condition. When you palpate this guy, he is a little lean. You can feel his ribs and his spine very prominently. He's probably having a hard time eating with teeth as they are like that. So it's always important, if you can, to just very gently kind of pull the lips back and take a look at the teeth, but at the very least watch how they're eating to make sure nothing looks off, because it's very common that we'll see these cheek teeth and the incisor teeth overgrown and creating lesions in the mouth, wounds in the mouth, growing into the lip. Also very important, if you see overgrown teeth in your rabbit, to get a veterinary exam. This is an abnormal finding. It means something else has gone wrong. Often there's tooth root disease and or very poor diet that led to that. And so a checkup is very important. We do get skull x-rays and intraoral x-rays on these rabbits, just like we would with a dog. And then the tooth trim is done with a dental drill bit. So we drill across them. We do not clip them. If you clip these long teeth, you're going to torque the tooth root, which the tooth root grows way down under here. And if we torque that and bend that, if there's not pre-existing tooth root disease and we break that tooth root, we're going to create it. So we never clip the teeth. We actually will drill them. We use a rabbit dental table, so it's made specifically for rabbits, and a rabbit dental pack. So we just saw him today. We're doing some labs on him to make sure nothing else is going on, and we're going to get these teeth taken care of today. We have Buffy with us today, and Buffy is a recovering torticollis rabbit, and you'll note that she has quite the head tilt here. Buffy developed torticollis, which was the inability to stand up or correct her posture or even eat on her own a year ago. And her mother was extremely dedicated to her and provided lots of physical therapy, supportive care, treatment. We did diagnostics and did diagnose E. caniculi in her. And after many weeks and really months of care, we are seeing Buffy back again today. We're rechecking her E. caniculi titer, so she has a little alcohol on her leg from the blood draw. But I wanted to share with you kind of where she's gotten to over the course of the year. So when they get stressed or worried, the balance does tend to get worse. But we're going to put her down and let you see her. So this is Buffy, our little dwarf baby, well, adult. This is a rabbit that was only able to roll. She couldn't right her posture. She couldn't eat. She wasn't even drinking on her own. And now she's sassy and opinionated. She does still have a head tilt, but she thinks this head tilt is straight. So as far as quality of life, she really thinks her head is correct. It's really not affecting her. She will stand up and groom herself. She's actually highly functional and, like I said, can be a little bit sassy every now and then. So the moral of this story is these torticollis rabbits, many of them, not all of them, can be saved, but it takes very aggressive, very intensive supportive care, and it's a very emotional and draining procedure for the owners and for the rabbit going through it. We do syringe feed them, we do physical therapy, correcting and fixing their posture. We always watch their down eye to make sure the eye is protected, because some of them lose the ability to blink, and that doesn't spread tears across the eye, and so we often do eye lubricant, and really just a lot of home care and TLC that goes into trying to get these rabbits back. But I think Buffy is proof that they can get back to normal and they can live a pretty darn good life. But we do watch things like her E. caniculi titer. We do take radiographs and look for otitis interna, which is another cause that will often show up like this. We did do things like Dramamine to try to help with her balance issue. It really doesn't have a very direct effect, but There's some evidence in the literature that it's helpful, and really we pull out all stops trying to do supportive care and help these bunnies get back to normal. And we have Sugar, a 7-month-old dwarf male rabbit, with us today. Sugar's actually a very social, very sweet little bunny today. And he was brought in for his first baby exam, and we had an important question from his owner that we get quite frequently. Why is it necessary to neuter a male rabbit? The owner's point was he never goes outside, he's only a house rabbit, so why should they neuter him? Do you know the answer? Neutering in male rabbits is actually very important. Bunnies, even this adorable and cute, will often urine mark their territory. I had one owner that I remember, her rabbit was a house rabbit and would run past her sofa and spray urine across the whole length of the sofa. It can be very territorial, so urine marking is common. Neutering reduces the hormonal influence, and it can reduce or usually eliminate this behavior. And then the other factor is cancer. So in female rabbits, there's a very high risk of reproductive cancer. Males can also get that. The risk is lower, but I have taken off many testicular tumors in rabbits. So by neutering your rabbit, you're not only improving your quality of life and their quality of life, but you're improving their health and preventing problems down the road. You should think of spaying and neutering in rabbits no differently than you would think of the necessity in spaying and neutering a dog or a cat. This is just a basic part of pet ownership or responsible pet ownership that should be done. The other question that comes up is it safe? In our hospital, we see roughly 5 to 10 rabbits every single day, and surgery on them are very common. But we've implemented safety procedures that are very specific to bunnies, and I think it's very important that every hospital that sees bunnies does this. Our rabbit surgeries do get preemptive pain control. That means we provide comfort before the pain starts. So it reduces the stress and prevents the GI complications. Everything we do in rabbits, we're thinking about gut health and preventing GI stasis or gut slowdown, because we know stressors and pain can exacerbate that. So preemptive pain control is number one. The other thing is our rabbits under general anesthesia are intubated. So there's a breathing tube put in their airway, so the airway is controlled for safety. And then the gas, the oxygen, and the anesthetic are delivered directly into the airway. Many places won't do this. They'll just put a face mask on them, meaning they have no control over the airway. It's much less safe. It does require specialized equipment to do it, but it is much safer in the long run. And then we always place an IV catheter in rabbits, just as you would have done for a procedure, and certainly your dog would have done for a procedure. And that controls blood pressure, it goes into back leg, and also gives them fluids. So again, we're trying to keep the gut healthy and make sure they stay hydrated during that day. And then they do go home with pain medication as well. And then the other question I get asked is, will they have to wear a little cone of shame? And no, we don't ever do those in rabbits. So we don't put a little lampshade or e-collar on them after surgery. They really are treated pretty much as normal. So unrestricted, we like them moving around because it keeps the gut moving. The sutures are all internal. There's nothing on the outside for them to go after. And the big thing is I just have owners watch the GI tract. We do send all rabbits home with critical care, and if there's any GI slowdown, we have them feed right away. And as soon as our bunnies wake up from anesthesia, we actually syringe feed them just to keep the GI tract moving. And then they are on pain medicines after surgery. We do a non-steroidal anti-inflammatory and an opioid. And that ensures a very favorable outcome and a long, healthy life for these guys. And I'll show you really quickly, because one of the other things I tend to see in bunnies all the time is we do sex changes, meaning it comes in as a female and I have to tell owners, nope, it's actually a boy. It's not real obvious when you look at all rabbits as to whether they're a boy or a girl. When we look at this one, the testicles are down right now, right here, so you can see them. But if you watch, they can easily be pushed up into the abdomen, and they'll go all the way up and you'll see nothing at all. So a lot of times owners just don't know if they have a male or female. So it's really important to get your first baby rabbit exam. We'll make sure the sex is accurate. We'll get the RHD, rabbit hemorrhagic virus vaccine, on board and start them out just like we would a young puppy or kitten. And so the goal is we set them up for success by making sure we do all the proper preventative care as good, responsible pet owners and give them a long, healthy, happy life with their new family. And we have Winston with us. And this is just a quick video because I think it's an interesting case for owners. But Winston's a 4-year-old rabbit, and he came in with a history of suddenly bleeding around his eye. And he had dried blood on his upper lid. He's got some inflammation in the eye or bruising. and he had some dried blood below the eye as well. And when we did a full exam on him, we noticed that his upper incisors had deviated in position. They were going off to the side now, and he had a little bit of dried blood around his teeth. And he had had several exams previously, and his teeth had always been noted as normal. So we knew this was a change for him as well. And so we did go ahead and get him sedated and did some x-rays. And he has fractured his incisor tooth. And the incisor teeth are these teeth up top. There's actually 4 of them, 2 big teeth and 2 little peg teeth behind here. And we'll do a close-up video so you can see a little bit more, because he's stressed right now and we don't want him worried. But the incisor teeth, you just see these little nubbins that stick out, but they actually curl in a half circle all the way around here. These are big teeth. And so the suspicion is that this was trauma. More than likely he jumped off of something and hit his face or his teeth on the floor when he landed, and or potentially the side of his face. And the nasolacrimal duct, or the tear duct, runs from here down through, following the bed of the sinus to the nose. And so if we have bleeding in the sinuses or in the nose, potentially that can reflux up the eye, and we can have bleeding associated there as well. More than likely trauma associated with this. Rabbits' teeth are very unique. As you may or may not know, their tooth crowns and the tooth roots grow throughout their whole life. And so when we have a fractured tooth, there is the potential for that tooth to grow back normally. But the big concern when we have trauma to teeth is that we can actually traumatize and injure the tooth root where it's growing, and then we can have continued abnormal growth or potentially infection in there as well. And that could lead to more chronic problems down the road. So at this point, we're doing conservative management. So we're treating for pain, inflammation, for infection. Watching the GI tract, because any stressors in rabbits can create GI stasis. So we watch that very carefully. And then we're going to follow up and see how he does as far as regrowth of this tooth and whether or not more procedures are needed. We can, and certainly have many times, removed all of the incisors from rabbits with extractions due to disease. And they actually do fine. They eat well. I get asked that very frequently, but they grind and chew with their back cheek teeth. And so even if we do have a patient where we have severe disease in front and have to remove them, they do fine the rest of their life. But we're going to try conservative management and hope that this grows out normally. But again, the worry is we have some deviation in both of those teeth. And so it's very tentative at this point. However, it's not as serious as we were concerned about. Even though this is a big deal for him right now, we're going to make sure he's comfortable with pain meds and good supportive care. And our hope is to get him back to 100% because he's a good guy. We have Lola with us today, a 15-month-old Holland Lop adopted from rescue. And she's gotten a wonderful, loving home, which this darling little girl deserves. And they're taking great care of her. She is spayed already. But today we're going to cover the 10 things or 10 questions you should ask your veterinarian before your rabbit is spayed. So it's very important that when you have any surgery on a rabbit, it's done by a veterinarian that's very experienced in rabbit care, anesthesia, and surgery. Rabbits are very different than dogs and cats. Procedures on them are different, their medical needs, their stresses and pain tolerances, all very different than what a typical dog and cat would see. So we just have a list of questions that we think are important that you can use if you're in another state and not able to get over here. Then just ask your doctor a few questions. The good doctors are going to want to answer them, and they're going to be proud of the care they provide and happy to discuss it. So number one, how much rabbit experience do they have? How many rabbits do they see a day? We typically see anywhere from 5 to 10 rabbits every day. Numbers and experience are important. They make a difference. You see and learn things over years of experience, not days of experience. So ask about numbers. Do they do pre-surgical blood work? This is important for any animal that has surgery, including people. But we want to make sure, particularly for an elective procedure, which means it's a healthy patient going into the procedure, that we have very healthy animals so we have the best possible outcome. And if there's a problem, a kidney problem, a liver problem, that should be addressed before going under anesthesia. And the only way we know that is if we can check a metabolic panel and make sure everything's okay. Some doctors that aren't as comfortable with rabbits may not routinely be comfortable with blood draws on them. It is a very straightforward process though, and really easy to learn, so it's a question that should be asked. And then comprehensive pain control. Rabbits are what we would call a prey species. And what that means is if they're being chased or exposed to danger in the wild, they're often at risk of being eaten. And so even little stressors in rabbits can be a very big deal. And stress in rabbits can result in GI stasis, which is kind of like colic in a horse. And stasis is basically where their GI tract shuts down. It's very common in rabbits. We see it pretty much every day. And so the preemptive pain control, or the pain control done during and after surgery to prevent stress and prevent stasis, are very important. And so it's not a matter of just doing surgery and sending them home. We actually give pain injections and pain medication before we do anything, so they're comfortable before we even get to that point. And every rabbit patient goes home on pretty significant pain control to make sure there's no discomfort and they rebound and are back to normal day one. So ask about what they do and how they do it. It's a good, reasonable question. And then dedicated nurse monitoring. Again, important for all animals, vitally important for exotic animals. In exotic animals, values and vitals can change on the drop of a penny. So we watch very carefully to make sure that the heart rate is staying steady, that the blood oxygen levels are staying up, that the depth of anesthetic is important. And typically in veterinary hospitals, the pet nurse is the one doing the anesthesia. And these nurses need to be trained in exotics, experienced in exotic anesthesia, and knowing what to look for. And a really well-trained exotic pet nurse is worth their weight in gold. They can make a life-saving difference. So ask about their experience as well. And then exotic-specific equipment, not something we would most commonly think to ask, and as an owner, you probably haven't been exposed to the equipment that's needed, but it is an important question. In rabbits, because they have this little face with an airway way back here and a tiny little mouth opening, you can't open their mouth and see the opening to their airway. What that means is getting a breathing tube into their airway is much more difficult than a dog and cat because you can't visualize it. That's called an endotracheal tube when we put the tube in the airway. The tube is important because it controls the airway. What that means is you have control of respiration or breathing during anesthesia. And this often requires specialized equipment. We actually use an endoscope where you can actually put the scope in the mouth, see the airway, slide the tube in. It's very stress-free and very quick. In a practice that rarely does rabbits, they're probably not going to have that, and they may just do a face mask, which does not provide any airway control. So ask about airway control. And then IV catheter and fluids. So just like your dogs and cats or people, an IV catheter should be put in the arm or the leg. We usually put it in the back leg. And that gives vascular control. You can give pain medicines or anesthetics as needed at the moment. And if there's any kind of life-threatening event, you have access or venous access to be able to control that. So it's an emergency prep procedure that's important. And then surgical monitoring or post-surgical monitoring is also very important. And that means after surgery, what is being done? Is the surgery done and then the animal's just placed in a cage and left? In these days and ages, hopefully that's not happening, but it's worth asking. Our typical protocol after a rabbit surgery is they're put in an incubator and they're on a timer with vitals taken every 5 minutes until we deem them appropriate to come out of the incubator. And then as soon as their vitals are 100%, because the temperature will drop a little bit during surgery, so we want it back up to normal. Once it's perfectly normal, then we start syringe feeding, and we feed while they're here that day. And again, this is to prevent stasis, and that's very important. And then internal sutures only. So some people will use external sutures on exotics. I almost always use all internal sutures. And because we use internal sutures, we don't have to use an e-collar or anything to prevent them from going after them because the sutures are kind of folded under the skin and not seen by the rabbit. And so they're not bothered by them. They don't have to be restricted at all. And then obviously a very important point is what's the doctor's experience in doing surgery on rabbits? And again, a doctor that's confident and has done a lot of these will be happy to talk to you about it. And so always ask about their experience and skill level. And then as far as go home and what you can do, this is just a side point. Our rabbits go home, as I said, without any type of collar. They are on pain medicine. We don't restrict their movement. We allow them to move normally after surgery, and actually like just regular movement because it kind of encourages the GI tract to move. And so the big thing we do is just have you watch that they're eating and pooping to make sure no stasis occur and give them meds. And that's really it. So rabbit surgery can be done very safely and very effectively, and a spay is vitally important in female rabbits because about 60% of them will develop cancer. But we want to make sure it is safe for them, and we do that with knowledge. And so hopefully this helps. And we just used her because it doesn't get much cuter than this. So we wanted to get a video of this little love bug who just got rescued and got her forever home. We have an adorable baby bunny. This is a fuzzy lop, and they have soft Angora-like fur. Absolutely sweet, wonderful little bunny. He just had a blood draw, so he has a little bandage on. But they do tend to get a lot of matted fur. Very common. These guys have to be brushed every single day because this is really fine fur. It will mat down to their skin. So if you can see here, we've got mats kind of all over. And these are very good owners who love their bunny. It's just very hard to keep this fur groomed. On these guys, we typically do shave downs or at least shave the mats and then just work on trying to groom them every day. Wonderful little bunnies, just remember, lots of coat care. Have you ever had a rabbit that was thin or losing hair or had flaky skin? Well, this little guy did. This is our follow-up video for Sparky, and we're going to let you know how he's doing. He was first seen as an infant bunny exam adopted from a pet shop. So Sparky was initially housed in a pet shop with guinea pigs. He came in pretty much emaciated. He was just all bones. He had very sparse coat with bald spots and really flaky skin pretty much everywhere. And he's back today for his recheck exam. So what did we diagnose him with? The main finding was he had ringworm. Now, ringworm is not a worm, which many people ask about. It's actually a fungal skin infection. And yes, both rabbits and guinea pigs can get this fungus, but guinea pigs do tend to carry a lot of it. So the fact that they were housed together gave a lot of opportunity for this young, immature bunny with an immature immune system to get this. And that was causing the flaky skin and the hair loss. And he was also very thin. He was probably fed guinea pig pellets, not rabbit pellets, and then kind of had to fight the guinea pigs for food. So, how's he doing? Well, you can see we have a beautiful coat and normal skin. So we did put him on oral fluconazole, an antifungal, and it has cleared up the skin beautifully. And more importantly, he's gained almost a pound in body weight. And he's 9 weeks old today and looking very healthy and very happy, and these ears are growing like crazy. Always check the coat and skin on your rabbits. Don't ever house them with guinea pigs. They can transmit many diseases back and forth, and two bunnies. And so we should always house them separately. But this is a success story. We're very happy for little Sparky here. And you wouldn't believe it looking at him, but he's a very opinionated little man already. He's a really good little bunny. We have Gerald here, a 1-year-old male neutered rabbit. And he's in his little bunny burrito right now. Gerald lives at an assisted memory home, and the staff noticed that he had been shaking his head. So we're just going to scoot him around here so you can see his ears. Common problem in rabbits. And if you look into the ear canal, this ear canal all the way down is full of scabs and redness or erythema, and it is present in both ears. And these are ear mites. Very, very common problem in rabbits, often not readily observed by owners because if you just look at him, you can't see that as readily. Things to watch for are scratching the ears, fur loss around the ears, sometimes from scratching, or shaking of the head. And it's a little harder to see in this ear, but it can be subtle. If you look at this ear just at a glance, it looks okay. When we turn him, when you look down in the ear canal, you can see the scabs go all the way down into the ear canal. This is a pretty good example of a more subtle presentation in the right ear, and then a very dramatic presentation in the left ear. We do give them a pain injection and clean these ears out because these are scabs. The mites actually bite and chew on the lining of the ear. These bunnies are very, very uncomfortable. And then we will clean these out. We coat them after we clean it with mineral oil. It's soothing to the ear and it helps drown any mites that are left. And then we use selamectin topically because these mites can be all over them, not just in the ears. And so we do applications just between the shoulders of a selamectin medicine and 3 applications of that, and typically they are fully cured and back to 100% with normal healthy ears and much more comfort once these are taken care of. And you can see Gerald is a very sweet boy and he deserves the best of care. If you look on the outside of this pinna, you can see on the outside that this area, even through the ear, is bright red, and that corresponds to the area of the scabbing. We call this erythema, and it's increased vascularity and redness, almost like a rash from the inflammation due to the mites and the irritation they're causing. Another important point is, again, the mites can occur on the body, and sometimes you'll see scaling or crusting or white, heavy, what looks like dander elsewhere on the body, and that can certainly be mites. Ear mites are one, but they also get walking dander or Chiletiella, which is a fur mite that we can see in them. We're going to get Gerald taken care of and get him more comfortable. We are sedated and did get a pain injection, and then the ears were cleaned out. Did do cytology, and we have many mites on the microscope. And this is the ear pinna after cleaning. You can see it's very ulcerated surface. There are lesions kind of throughout the inner pinna, so pain control after this is very important with these bunnies. And watching the ears, doing regular maintenance, make sure they're not shaking their head or scratching, and then early exams will prevent a lot of this. This is the normal surface of the ear here, and then if we look down in the ear canal, you can see the ulcerations where the mites were. But we are starting topical treatment with acetaminophen, which will kill all the rest of the mites. We've cleaned out the ears, and we expect this little one to be 100%. We'll just control pain and inflammation.